Hi guys, welcome back to the Recovery channel. This is a series of videos detailing my recovery from a major stroke and just explaining how I did it and how I recovered and how I've been helping other people. I have been trying to upload one video a week, but I was in hospital last week, pretty much all week, so I missed last week's video, but it encouraged me to write a video to talk about why I was in hospital. You've probably guessed by the title of the video that the issue was low blood pressure, but I just wanted to describe how low blood pressure affects me after a major stroke. Firstly, I wanted to plant a flag and say that low blood pressure is not usually attributed to causing strokes. Quite the opposite. High blood pressure is a problem with strokes, so low blood pressure wasn't going to cause me to have another stroke, but it was having some effects on me. So I've been back to hospital 6 times with an ambulance, with lights and sirens, people thinking I was having another stroke, 6 times since the major stroke. So I want to explain why I had to keep going back to hospital and what had happened. I was having these sets of symptoms or episodes where the left side of my face would droop, my left arm and leg would get really weak, to the point where I could barely use them again, whereas usually they're quite good. I've regained most movement back, but during these periods I lost all movement and I'd get dizzy and confused, so my partner would call an ambulance and say, looks like he's having another stroke, so come and pick him up. So I'd get rushed to hospital, thrown in the CT scanner, they'd have a look at it, realise I wasn't having another stroke, so they just monitored me for a few days. Sometimes I was in there upwards of a week, depending on how quickly my movement came back, really. The neuro team were kind of scratching their heads saying, we don't know what's happening. He's got low blood pressure, but it's not really a problem. They thought it might be seizure activity, so I had all these EEG tests, and they said it looks like it could be a seizure, but it could not be, so they took my license off me again. I was able to get it back within about a year after having no seizures. But then these episodes kept happening more frequently, usually when I was really tired. I was trying to return to work at the time in construction, and if I came home really tired, I'd have one of these episodes. But last week it happened again, and once again my partner called an ambulance. I had a brain scan, a CT, and they said, you haven't had another stroke, so we'll monitor you again. I went up on the ward for about a week. They noticed that my blood pressure was often quite low and my heart rate was low. My heart rate would get down to 30 while I was just lying in a hospital bed. My blood pressure was always about 104 on 60, which is on the low side of normal, but not usually a problem for people, so they were quite happy with it being that low. But being that low, if I had another drop in blood pressure, which happens to everybody every day, it would bring on these stroke-like symptoms. And they said they had a meeting with the other neurologists, and they looked at my brain scans and decided that my middle cerebral artery, which is the artery feeding the new part of my brain that I'm using, is quite narrow, and if I had low blood pressure and I had a drop, then the new part of the brain's not getting blood and it'd produce these symptoms. So after 6 hospital visits in 4 years, it looks like it could be something as simple as low blood pressure. So I'll just have to learn to manage it, really. So thanks for watching, guys. I hope this video helped somebody else that's having the same problems with blood pressure after a stroke. I'm getting lots of emails on strokerecovery@gmail.com asking questions, asking me to write videos to talk about other people's experiences, so keep the emails coming and I'll be answering all of them. You can also get me on Facebook or Messenger. I'll put a link up here for it. Make sure you like and subscribe to the channel and share it with anybody who needs to see it. Thanks, guys.